Hello, everybody. I would like to welcome you all to this session, the EASO New Investigator Award in Public Health. My name is Susanna Lehtinen-Jaks, and I am the co-chair of the Public Health Task Force of the EASO, together with Dr. Harry Rutter, who unfortunately could not join us today. However, on the behalf of the Public Health Task Force of the EASO, I have the pleasure to announce this year's winner of the EASO New Investigator Award in Public Health. And the winner of the year 2020 is Carmen Piernas, a nutrition scientist with a PhD in nutrition and epidemiology and working as a postdoctoral researcher at the Oxford University, UK. We are very impressed by Carmen's research combining nutritional epidemiology with behavioral science, with the aim of promoting and sustaining healthier diets at the population level. And today, Carmen will share with us about her contributions to interventions to improve the quality of the grocery shopping for the prevention of chronic diseases. So in summary, I would like to express our warmest congratulations to you, Carmen, and the floor is yours for your presentation.
Many thanks to the organizers and to the EASO for giving me this award. I'm really grateful for that. Is my screen okay to start? Okay, I will then discuss all the work that I've been doing at the University of Oxford. I'd like to start with a little bit of background, reminding all of us that our diets, whether healthy or unhealthy, start in the grocery store. And most of us, especially during lockdown, the majority of the food we consumed came from supermarkets. So it's especially relevant to improve the quality of the supermarket grocery shopping for a healthy diet. And it's also important to remind ourselves that once the food is around the house, it's likely that we will eat it. So there is a real opportunity to improve the quality of the food that we have around the house from supermarkets to live healthier diets and healthier lives. The governments also around the world and the public are encouraging the food industry to take action and support healthier choices. And that's also part of the reason we got interested in healthier food purchasing. But finally, there's a lack of current evidence on effective strategies for intervention within grocery stores, but also at the individual level. Therefore, I'm going to present a raft of studies that we've been conducting over the last few years on this field. I will start with experimental online shopping studies to build evidence base for testing in other real scenarios. This is using an experimental online supermarket that we are hosting at the University of Oxford. It looks like a real online supermarket, and it's got a grocery set from different retailers that you can customize, and we can test different interventions with this experimental platform. For example, we conducted a study to reduce saturated fat in online shopping, where we tested food swaps with lower saturated fat, as well as the prominent positioning of foods with lower saturated fat. So things with foods with lower saturated fat were appearing higher up in the list when people were shopping. And we looked at saturated fat content of the final basket. And the primary outcome analysis compared to control, we found that swaps did reduce saturated fat by 2%. The order of the foods reduced saturated fat by 5%, and the combined intervention achieved slightly greater result, 5.4. So altering the environment, which is the prominent positioning of the lower saturated fat foods, were more effective than the individual level intervention, the swaps, which requires a conscious decision making and perhaps more difficult to implement or less acceptable for individuals. Also, interestingly, there is no evidence that reduced saturated fat in the basket increased the cost of the basket compared to control group, or any differential effects by sex, age, ethnicity, BMI, or sociodemographics. So the implications of this research is that we can provide evidence-based, but we need to test these things in real supermarkets and see if these effects are being maintained for a longer period of time. So the next phase of studies we've conducted were to develop and test interventions where we can provide brief support and personalized advice on shopping for reducing LDL cholesterol. And this is the PC Shop study that I will introduce now. So why providing behavioral support for healthier diets? Well, first of all, there is evidence in primary care that these kinds of brief interventions are effective for weight loss. But for nutritional or dietary interventions, we know that there is limited time and lack of knowledge among the healthcare professionals to really provide much more than, very general advice or motivation. And therefore, we thought to complement this advice with advice coming from your supermarket. And this is essentially looking at purchasing data that is being collected through the loyalty card schemes and use it to look at, to provide personalized information and feedback and monitor the diet composition. So we designed the PC Shop study as a 3-arm randomized trial with a 3-month follow-up where we measure saturated fat intake as the primary outcome, and secondary outcomes were saturated fat in shopping and blood lipids. We recruited people in primary care practices with high LDL cholesterol who were willing to change their diet and shopping at Tesco, which is one of the major UK supermarkets. Had a loyalty card scheme that and were happy to provide this data to us. We randomized people to the control group, which received a letter with the results, so nothing else. Then one group got brief advice and support from a healthcare professional, usually a nurse at the GP practice, using a leaflet from the British Heart Foundation. And the third group got the brief advice, but also a personalized shopping report, which I'm going to show you in a minute. This is a bespoke, we created a bespoke program to basically, we received weekly shopping and we processed that data to create this kind of report where we highlighted the top 5 contributors to the saturated fat in the basket, and we provided 5 swaps, which were similar in culinary use or properties, and we sent these reports monthly to the participants in that group. We recruited 113 participants, age 62 on average, with overweight. Mostly were women of white background, and few of them were taking medication. They were avoiding taking the medication, but all of them had high cholesterol or high LDL cholesterol. What we found was a non-significant small change, but in the right direction. As you can see, the brief support and brief support plus shopping feedback groups reduced the amount of saturated fat from dietary recalls compared to control, as well as the percentage of saturated fat from purchasing compared to control. But these changes in comparison to control were not significant. They were in the expected direction, but they were too small to be significant. We also looked at changes in food groups from the dietary recalls. And we found, for example, compared to the control group, there were some small changes in cakes, biscuits, and meat, specifically in the brief support group. The brief support and shopping feedback group, however, decreased slightly more in high-fat cheese and high-fat spread. So even though these changes are, again, not significantly different from control, they gave us a few hints of different mechanisms for changing diets that we observed between the arms, which potentially reflects the advice provided. And I'll highlight this because in the shopping report, the majority of the swaps that we provided to participants were on dairy, spread, and cheese. and less of the swaps were for desserts, biscuits, and a smaller proportion for meat products. So it's not surprising that this group had reduced more in high-fat cheese and high-fat spreads, whereas the group that only received the nurse advice had reduced more in meat, for example. Finally, the latest piece of work that I would like to discuss today was around collaborations with food retailers that we've been working in the recent years to pilot and measure the effectiveness of interventions in real retail environments. And this is a project called Collaboration for Healthier Lives, led by the Consumers Good Forum. University of Oxford is one of the partners helping with the evaluation of natural experiments in London. And we've got so far data from for a specific retailer for 34 intervention stores and 152 control stores. And we found, for example, one trial of removal of seasonal confectionery displays. We found the intervention stores had a reduced percentage change in confectionery sales compared to control stores over the intervention period compared to the control period, which was the same time of the year before when the intervention happened. And we found very similar effects on another trial where they stocked a lower fat frozen chip next to the regular frozen chips in the stores. We found, compared to controls, again, a significant effect of reduced sales of regular chips compared to control stores over the intervention period compared to the control period. And in summary, I just tried over this different studies and designs to give you a flavor of what we've been doing. And the take-home message is that overall, we believe that supermarkets can be slightly more proactive to encourage healthier options. They've got the capacity, and some of the interventions that I've shown here can be potentially helpful for people. Individual level interventions, such as the PC Shop study, have shown good evidence of feasibility and acceptability among people. And the changes were small, but in the intended direction. If we can achieve similar changes at the population level, that would be a really good outcome for public health. And we've also shown how we can use loyalty cards in a novel use and digital technology for monitoring or personalized feedback and swaps for more personalized dietary advice. And the low cost and scalability of these interventions means they are potentially very cost effective and could benefit the entire population. So in the future, well, we continue or hope to continue a strong public dialogue to get their views on use of customer data and acceptability of interventions in grocery stores. We also hope to get links with researchers across the world to use our experimental supermarket, digital tools, algorithms. We also hope to get more links with funders, charities, food retailers, and chains that have similar goals, and we hope to develop governance arrangements for collaborations and secure independent research funding. And finally, I'd like to thank my team, especially my mentor, Susan Jebb, funders, collaborators, PBI, panels, and GP practices and study participants. Thank you so much again for this award. I'm really happy to take any questions.
Thank you, Carmen, for a wonderfully interesting presentation. Unfortunately, I can see no questions in the chat panel, but I would like to ask you a technical question about the loyalty cards. So was it the participants of the study who shared their loyalty card information for you, or how did that work, and with the ethical question?
The participants consented to us to get this data from the retailer to us. So they specifically consented for this information to come to us from the retailer.
Okay, thank you very much.
Otherwise, it's hard to get this kind of data these days. It's getting easier, but it's still hard with the new GDPR laws and everything.
Exactly. And now I can see there is one comment which I hope we will have time for. And if not, you can answer it later on. I'll just read it from here. Super interesting interventions here, obviously based on a huge amount of background work developing the shopping platform and feedback systems. Congratulations. Given your work on whole diet patterns, which suggests optimizing multiple nutrients is associated with body mass index and cardiovascular diseases. Do you think that the next step should be to target multiple nutrients for swaps or nudge so that the overall dietary pattern changes? Could that be more powerful for impacting health?
Definitely. We have done work that has been presented by my colleague Ming Gao previously in the UK Biobank that shows that we need to move away from the nutrient-based into the food-based recommendations, which is what people really understand and can feasibly adopt. And therefore, these trials were proof of concept to show that for a single nutrient, it could potentially help. But of course, the future is to adapt this system and the algorithms to provide healthier foods in every sense, which means higher fiber, less saturated fat, less sugar, less salt, and more nutrients with lower calories. And this was just the first step for a proof of concept idea that we have tested and for the feasibility and acceptability. And now it's where we need to move forward and aim for the whole dietary pattern approach.
Okay, thank you very much. It's time to close the session. So congratulations again, and we'll be hearing from you in the future, I'm sure.
Thank you.
Thank you, everybody. Bye.
Okay, thank you. Bye-bye.